Review of this surgical set, BL3 Implants. BL3 Implants multi-purpose set has been designed for performing surgical and orthopedic stages of dental implantation in various clinical cases. Set is complete with all necessary instruments for correct performing of the operation. There are conical-shaped drills in the set with diamond-like coverage. This advantage of the drills increases lifetime of cutting properties comparing to regular steel drills. The shape of the drill replicates perfectly the body shape of the implant without thread. Due to this shape of the socket, after its forming, matches the shape of implant installable into this set. All drills are presented in order from 1st to 9th number and located in the set in ascending order based on their diameter. First drill is called marking drill and is used for determining of the place of future implant and for passing of cortical layer of alveolar crest. Its diameter is 1.9 mm. Second drill is pilot, tubular-shaped, 2 mm in diameter and is marked with white ring. This drill is applied for setting the depth and axis of the future socket for installable implant. Next drill is 2.8 mm in diameter. It's the second pilot drill, tubular-shaped, which has red marking. There is a set of stoppers for 2.0 and 2.8 mm pilot drills. They are limiters for the depth of drilling, which guarantee forming of the necessary depth of the implant site. This set is completed with stoppers of 4 various lengths, matching each length of the implant: 8 mm, 10 mm, 11.5 mm, 13 mm. All the following drills are the finishing drills, since they may be applied as the last drill before the installation of the implant under classical surgical protocol. For example, 3 mm diameter drill is the finishing drill before the installation of 3.3 mm diameter implant. 3.5 mm diameter drill is the finishing drill before the installation of 3.8 mm diameter implant. 3.9 mm diameter drill is the finishing drill before the installation of 4.2 mm diameter implant. 4.3 mm diameter drill is the finishing drill before the installation of 4.6 mm diameter implant. 4.7 mm diameter drill is the finishing drill before the installation of 5 mm diameter implant. And the last one, 5.2 mm diameter drill, is the finishing drill before the installation of 5.5 mm diameter implant. It's important to remember that depending on clinical case, surgical protocol could differ from classical. For example, for the first type of the bone tap could be used after the finishing drill. And for the fourth bone type, finishing drill could be used with diameter that is by 1 or 2 units less than it's defined in classical protocol. There is multi-purpose ratchet wrench and device for it, which turns the ratchet wrench into the torque wrench. On dynamometer part of the cover, there is engraving indicating from 10 to 14 Newton, which are maximum values for screwing of orthopedic screws. This is because torque wrench is used for determining the required pressure while installing the orthopedic constructions. Its convenience is that when the pressure is increasing, at any stage of screwing, the orthopedist is able to see what pressure he/she shall apply to the screw at this very moment. One more advantage of such wrench is that if it is necessary to change the direction of rotation, you don't have to throw it over. All you have to do is to change the direction of the handle. This instrument includes 2 useful tools. On one side, there is depth gauge with markings, which allow determining the depth of formed side at the stage of pilot drilling. On the other side, there is Mucus height gauge, so in future it is comfortable to define transgingival height of healing abutment and abutment shoulder. There are implants, adapters and wrenches in this block, which we are going to consider in more details. 4 implant drivers for Ratchet range for convenience while inserting the implant in bounded space and in a distal area. 9 and 18 mm length for standard platform. Diameter of standard platform implants is 3.3–3.8 mm. 9 and 18 length for wide platform. Diameter of wide platform implants is 4.2–5.5 mm. Next is Implant Adapter for the Ratchet range, which is used for extraction and installation of the implant of premium complete set. Next is Implant Adapter for Ratchet range, which is used for extraction and installation of the implant with hex-shaped implant driver. 2 multi-purpose orthopedic screwdrivers for any kind of orthopedic screws used in a system. They are convenient and practical since they can be used with torque wrench and as manual screwdrivers because the top part of the screwdriver has a mobile disc of blue color which helps to ease manual screwing of the screws. The last 2 instruments in this row are countersinks for cortical layer. They are used for reducing exceeding compression in cortical layer. Each has 2 steps, meaning the diameter for countersinking. The instrument with black and green marking has bottom step diameter of 3.8, top diameter of 4.2. The instrument with white and brown marking has bottom step diameter of 5 and top diameter of 6. There is drill extension in the next block, which makes possible drilling in bounded spaces. 2 implant drivers for tip for standard and wide platforms. Next, short and long implant drivers for mechanical insertion during installation of implant of premium complete set. There are also 2 pathfinders used for parallel drilling of several installable implants. Their markings are depth gauge. There are 2 empty spaces in the set, so implantologist is able to complete them with necessary instruments which are not included in the set, for example with taps. In general, box and its parts consist of heat-resistant plastic which could be exposed for autoclaving or chemical treatment. Signs on the marking are resistant to impact of chemical substances or high temperature as they are inserted with laser etching. All details of the box are removable for convenient washing. Surgical case is packed into metal briefcase for comfortable storage and transportation. Today we have demonstrated all details which are included into surgical set. As you have already noticed, this set includes all necessary instruments for simple and comfortable use during surgical or orthopedic stages of implantation. There are no rarely used instruments in it, which can distract doctor's attention during operation. BL3 Implants professionals have created the perfect set for your convenience during implant treatment of your clients. Let your use of BL3 implants be extremely pleasant, and we shall meet on our following BL3 insights.